Good afternoon, Governor.
Good afternoon.
We're going to begin with this question. Barbershops and hair salons are shut down generally, but can such operations inside facilities such as nursing homes and the prison continue?
No, they should shut down also. The reason that I signed an executive order around things like barbershops, nail salons, tattoo parlors, spas, massage, it's not about where they're located, it's about the fact that they are quote-unquote close in contact businesses, and what we're trying to avoid right now is all close contact. So they should all be shut down until further notice.
Okay. Is the Department of Health retesting presumptive positives to determine whether any are now negative for COVID-19? If so, how many have tested negative?
The Centers for Disease Control and Prevention have relayed guidance for us on how to follow someone who tested positive until they have resolution of their symptoms to be able to say that they are cleared to go to work remotely, hopefully, or for other essential activities that they need. To be able to preserve the testing that we have now for our higher priority populations, we are and have shared these guidance rules to providers so that if someone has symptoms for at least 7 days, with the final 3 days of that showing improvement in their symptoms, and the final 3 days also being without a fever, in the absence of any fever-reducing medication, then it's acceptable to consider at the end of at least 7 days since the start of those symptoms, someone as being negative without having to get a test to confirm that they're negative. This is evolving, and this is information we have shared with providers and will continue to work with them in doing that. We also want to share it with employers so that people are not needing to go to their healthcare provider to get a note in order to return to work. We know that this is a shift, but we want to minimize the amount of input and requests to healthcare providers, knowing how critically busy they are right now. So this type of information is what we will continue to share and make available for providers as well as for the public.
Our next question asks, what can people who work in manufacturing companies who are elderly and have an underlying condition do to stay safe when the company has no plans of closing?
Yeah. So I'll say a few things. First, I would ask the company to make every provision to allow every employee to work from home. I recognize that's very difficult, especially manufacturing. If there's anything that we can do to assist with that, providing laptops, providing software, providing coaching, 521 help. Secondly, the only reason I'm allowing businesses to stay open is because they're supposed to be open with certain conditions. Screening employees every day to make sure they're not sick and sending sick employees immediately home and paying them for sick time. Keeping a certain amount of distance in between employees. We're doing spot checks of businesses. If we walk into your manufacturing operation and see people all bunched up, we will close you down. We need you separating employees. Opportunities for people to wash their hands, hand sanitizer available. And so these are the requirements that we have for employers in order to keep their employees and the people of Rhode Island safe. Specifically, as this question, this is everything I'm saying applies to everyone, but it's absolutely true if you have any elderly employees.
The next question is about Rhode Island College. RIC employees claim they were asked to clean a dorm room where an infected student was living, but were not informed he was sick. Should the college have notified the employees a student had been tested, even if the results had not come back yet?
This is important because we are working closely with any facility who is evaluating whether or not a person's illness is COVID-19. So it's important for the public to know that we will always make sure the facility takes into place the actions and steps that are needed to keep everyone safe that's there. There are many viruses that are circulating, so we wouldn't want to automatically say that COVID-19 is the cause of someone's illness, but we always want to make sure that the facility or institution is implementing the infection control practices that are needed and are in place. We know now the results for this patient with Rhode Island College, but have already activated the infection control practices that are needed to make sure that the students and others there are safe. And that's the approach that we will continue to take, finding the balance between making sure the public is informed and the agency and institution have the information that they need, while also protecting the confidentiality of the patients and the information that we are learning on their individual case.
And just to continue that thought, Dr. Scott, are you instructing entities like colleges or hospitals or the towns not to notify their communities about positive tests?
We are not having any conversations along those lines at all. We, from the health department's standpoint, certainly have a standard approach that we want to make sure we find the balance with that I'm sharing. We certainly want to make sure it's known if there is a positive that it's helpful for the public to know about, but also want to protect the confidentiality of the patients and the families who are involved. We have always said that any companies or institutions that prefer to, on their own, release the information about where a person works in collaboration with that individual themselves, then that's something that is acceptable for the institution. But we will continue as the state agency to really strike the balance that's appropriate for the patient and their family as well as for the public.
There remains a lot of confusion among sick people, doctors, and hospital workers about who has the authority to approve and administer a test and who makes that decision.
As we're working to expand testing, and we appreciate everyone's patience because work has been done to get the testing supplies into place so that we can do this steadily and sustain it, we want to make sure that we support providers in being able to order the tests that they need and to offer them the process through which they can send a patient to get the test. We do not want it to be something that is held up by the Rhode Island Department of Health. We want to work in coordination with providers. We still have some time to get there, though, so continue to call providers, and providers will work through how you should respond, particularly if you have symptoms, and the treatment for being able to stay at home to recover safely there. Once the expanded testing is available, then that will be an option. Until then, it's important for patients to know that the treatment is still the same. If someone has cold symptoms, consider it similar to COVID-19, and follow these instructions of staying home and recovering safely if you are ill.
The next question is for the governor. Do you have any plans to waive mortgage payments for people out of work because of COVID-19? Why or why not?
At this point, that is something that I think the federal government is working on at the federal level, which I think would be appropriate. We are taking action around evictions to make sure nobody's evicted in the next month or so. I would implore all banks and lenders to provide as much leniency as possible and do as much individual underwriting with individuals as you're able to do, considering that a lot of people are struggling at this time.
Block Island is in shelter in place. How will the state enforce this, and what do you say to second home owners who are thinking to travel to their second home there?
So I'm hearing this question a lot from Westerly, and Block Island and Newport. At this point, I have chosen not to do a shelter in place for the state. Having said that, the concern I'm hearing from these coastal towns is lots of folks are flocking from New York City to their summer home. New York City is obviously a hot spot, and people in Westerly, Rhode Island residents in Westerly, Newport, and Block Island are getting nervous. First, I think it is completely appropriate for those town managers and mayors to take the action that they think is necessary to keep their community safe. As a matter of the state, I'm not taking that approach, but if you live in a small coastal community, by all means, as a mayor or town manager, do what you think is necessary to keep your residents safe. I would say, I think it's completely appropriate for folks who are coming from New York City to, of course, use their second home, but they ought to quarantine at home. They should stay at home because, as Dr. Scott said, more than half of our cases in Rhode Island have been as a result of domestic travel. We know that New York City is an absolute hotspot, and so if you're coming here to use your second home, be responsible and quarantine yourself for 14 days. But mayors and town managers have my full support to do what they think is necessary in their towns.
Next question is for Dr. Scott. When is a positive case considered recovered, and are any of the current cases recovered?
So when patients have recovered, they have had symptoms for at least 7 days. They have had the remaining end of that time frame where they have had improvement in the symptoms. And for the final 3 days of that time frame, no fever, without the use of any fever-reducing medication. There are many, many patients of our 124 who have recovered.
This next question is about a glimpse of the testing. How many people are being tested a day, and what prevents testing for more people right now?
The number of people being tested a day is slowly expanding. Our Rideau State Health Laboratories can do over 200 tests a day. What we have been focused on, and I really credit the governor and the team that's in place to help us address this, is similar to other states nationally, having the laboratory supplies for collecting the specimen and doing the testing in place has been critical. And with the governor's leadership, we have been ahead of connecting with the companies that can provide these supplies for us. As we're getting a stable influx of those supplies, it will allow us to continue to steadily expand testing. We want to get to the goal that the governor has shared over the next several days, so we need people to be patient and to continue to work with us to be able to test as many people as we can. Once we have that stable influx of supplies that we as a state had to work hard and get in place, then we will be able to work towards that expansion. In the meanwhile, whether you test positive or have symptoms, the treatment of being able to stay home and recover safely there is the same.
And Governor, in your earlier comments, you mentioned that the Disaster Emergency Funding Board will be meeting on Thursday. The question is, will it be open to the public, and is the meeting constitutional under separation of powers?
I believe certainly the public will have access. I don't know how the leadership is yet going to arrange the meeting, but there will certainly be some opportunity. It's absolutely constitutional, and frankly, it's necessary at this point in time. There's a specific law on the books that provides for this. Now that we're in a state of emergency, I'm calling on the General Assembly leadership to do this, and I appreciate them acting swiftly so we can take the necessary action. I want to take a second to follow on to the question about testing, because it's coming up a lot and it's actually incredibly important to understand. Last Thursday, President Trump said to the governors, the federal government is here to help you somewhat, but you're essentially on your own to go into the open market and procure whatever medical supplies you need. That includes testing. So what that means is right now we here in the state of Rhode Island are building our own supply chain network to scour the world to find all the supplies that we need in order to do the testing. And by the way, we're moving swiftly in this direction. The reason the testing is hard, well, first of all, every state is vying for the resources. Frankly, every country, most countries are vying for the same resources. So it's a challenge. Secondly, there are many pieces to this. You need the swabs to do the specimen collection. You need the PPE for the people to wear who are collecting the specimens. You need the testing kits. You need to transport them. You need to have the machines. Each machine has its own reagent. So right now, it is my goal to be able to get us to a place by this time next week where we're testing 600, 700, 800 people a day. And I believe we're going to get there. That is absolutely vital to happen before I can reopen the economy. In order to reopen the economy, we need to be able to test rapidly, effectively, at volume, and then pinpoint the people who are positive. So just to kind of give a feel for what we're dealing with and where I'm trying to drive this, and also it's not just flipping a switch to do the tests, because there's 10 or more medical supplies that we need in order to make this happen.
And could I just add, Rhode Island Capital TV will air the meeting both on air and online on Thursday afternoon, and make available a feed for any media outlet.
Great. Thank you.
The next question is for Dr. Alexander Scott. Can I understand the 124 confirmed cases are cumulative from the start of the crisis? How many people are currently infected and how many have recovered? In other words, how many active infections do we have?
Yes, these are the cumulative number of cases that we have had as a state since the start of this crisis. The time frame that it takes for infection is usually about 10+ days or so. So people who have been infected prior to the last 10 to 14 days have begun to recover. We are continuing to monitor those who are in the hospital, and those patients are going home, but we're following it closely because this is evolving. We certainly are seeing more numbers of cases each day, as we have anticipated, and are needing to continue to work closely with our hospitals and truly reiterate the value and necessity of everyone staying home to stop the spread of this virus and not spread symptoms of illness from one person to another. That's how we continue to decrease the risk of transmission that's occurring.
And our last question today is again about the spreading. Is the percentage of positive test results increasing? You've said there is community spread. Are you seeing spread among family members or people quarantined due to direct contact with positive cases?
The percentage of positive test results are in alignment with the number of tests that we're doing. We are continuing to prioritize our hospitalized patients, congregate setting patients, including nursing homes, as well as healthcare workers. So as we continue to test those, we will identify people who are positive. We have not seen cases of patients who are quarantined and then becoming exposed to other contacts, but it is an important element for us to continue to follow, which we're doing.